Hi everyone, Oksana here with my sister Victoria. So we just announced actually a couple of hours ago that we're gonna go live in this group, and so let us know where you're tuning in from, as well as those of you who don't know who we are. I know that we have a lot of followers, people who have been following us for a while, but then you're not really sure maybe what we do and who we are. So our background is in immunology. I do have a research lab in Michigan, and also that's where our studies come from, immunology. So we're immunology researchers. So, but we also help people with autoimmune diseases, reverse autoimmune disease with nutrition. So, how can I make the screen bigger, Victoria?
You click on something.
Dashboard, maybe? Okay, great. So again, if you're watching this video, say hi to us. Let us know where you're watching this video from, as well as what is it you need help with. There's a lot of people. We have around 5,000 followers and even more on other channels. Hi Melanie, good to see you. And almost every day we post in this group and in this page people that we're personally helping reverse autoimmune diseases and chronic conditions. We have clients who reverse diabetes within 30 days. Their blood sugar normalizes. We also have clients who, in addition to that, they start being able to repair their kidney function. And one of the things that's really frustrating to us is there's a lot of doctors out there, and there's also other functional medicine doctors who tell you they can help you with kidney diseases, but we know that what they tell their patients to eat is actually inflammatory. So be careful when somebody tells you we can help you heal your kidneys, especially something like lupus nephritis or end-stage kidney disease, and they don't have the results that our clients get. We actually have our clients improve their kidney function by 10%. So the GFR goes up by 10 points within 30 days. That's what we've seen with some of our clients who have kidney diseases. So that's why you want to make sure that if you're taking advice from somebody or the person that you choose to work with, they have the results that you want, okay? Yes, once again, if you're watching this video, say hello to us. Let us know where you're from and how we can help you. Because I know there's a lot of people in a Facebook group that been in a group for over a year. So if you still need help, let us know. Oh wait, is the audio on? Yeah, the audio is not. It's not working. Okay, can you just make it loud so it still works? You saw? Mm-hmm. You heard it? Mm-hmm. Oh, can you let us know that you can hear me as well? So let me know that you can hear me before we move on with the topic, okay? So we're just gonna share. We're actually gonna go live in our group as well. Again, so if you're watching this video, let us know. Hi, Crystal. Good to see you. Yeah. So, oh, good. Thank you for letting us know that you can hear us, because I wasn't sure. Yeah. So actually, audio was on. Was off. So one thing that we want to talk about is that a large number of clients that we have worked with report to us that they've been symptomatic for 5 to 10 years before their lab work finally showed that they have a specific type of an autoimmune disease. And they tell their doctors that they're actually tired and they've been in pain, but since their labs still look normal, they do not meet the criteria for a diagnosis and they send away. So some tell us that their doctors will actually tell them that you don't have an autoimmune disease yet, you're fine. Or some will even send them to a psychiatrist or put them on antidepressants. How many of you have heard that from your doctor? There's nothing wrong with you, just take these antidepressant medications. And I do remember at one of our medical conferences, we do attend a lot of research conferences all over the world, national conferences as well. There was a committee and they are looking for autoimmune cure. They're looking for cure for autoimmune diseases. And when they're looking for a cure, they're looking for medicine. So that's why billions of dollars goes into research and into organizations to promote all of it. And there's a lot of pressure not to get our information out into the public, because we do not use medicine, supplements, or any therapies when we help people reverse their symptoms. So when somebody took a medicine and all of the autoimmune markers went negative, Western medicine would call that a cure. Unfortunately, the way that our system is set up, that only medicine can be used as a cure. And it will always be that way, that there's no cure unless somebody comes up with the medicine to do so. But that doesn't mean that people can live a normal, healthy life without a disease and not have to use the medicine to get better.
Yes, so that's what we learn in school or from doctors, that the diseases like that, they never go away. And then they have to be on medication for the rest of their life, or they have to take the medication or take the supplements, which is not true. So it's only true if you stick to the medications for treatment rather than making proper lifestyle changes to treat the actual cause of the disease and give you the body all the right tools it needs to repair itself.
Yeah, that's what we've seen over and over again, is that when people who follow a process, who work with us personally, and we help them with the inflammatory condition that they're dealing with, they do improve not just in their symptoms, but also their lab markers. And when they keep going, doing everything that they learned, working with us, they do become symptom free. And the reason is that what we're doing is we're actually optimizing your immune function and supplying your cells with what they use for healing and cellular repair. And when you think about it that way, it makes sense that it can help you eliminate an infection, it can help you with the heart disease, it can help with inflammatory neuropathies. We've had clients who had neuropathies that improved, just as it helps with autoimmune diseases. Just recently, one of our clients with neuropathy symptoms, with diabetes, type 2 diabetes, with Hashimoto's disease, all of her symptoms were gone within 6 weeks. And that's when we work with each person and guide them through the recovery, you can see that it does work. Not only do people get better, but they're able to actually, with the doctor's supervision, reduce the medications and get off of them completely. That's why medicine is only part of the equation, but as long as you continue taking medicine, you become a patient for life. And people never get better because there's hundreds of side effects with every medication. And what people need to do is learn the proper changes they have to make to their nutrition and lifestyle to be able to recover the symptoms and get your health back, so you don't have to rely on medications.
Yeah, so let us know if you have any questions about it, what we just talked about.
Yeah, let us know. Let me see if I see any comments. Hi, Annabelle. Good to see you. Hi, Dalisa. So, Melanie, our next program already started. We've been announcing since March. So we had the March and May. We've been announcing the next program every single week, almost every month. We're announcing when the next program starts. So if you missed the announcement, it means maybe you're not seeing the notifications. We announce in a stories. We announce in a page, in a mailing list as well. So next program it's already started in July. And the one before that was in March and in May. So if you plan to work with us, you need to reserve your spot 4 to 6 weeks before the next start date, because we do fill up all of our spots. We have limited spots available in our program. And that's why there's a 4 to 6 week waiting list for the next one. So if anybody's looking to work with us, you need to have a call with us now and reserve your spot in the next opening. And because we don't have a next opening available yet, but we already booked for July. And unless it's a case of emergency, if somebody has a case of emergency, then you can start in the program now, but you have to let us know, okay? That you have a case
Yeah,
of
so actually
emergency.
I want to talk about the new topic that a lot of people, they used to this habit when they plan to do something. So they're in the habit of planning, which makes you feel like you're doing something, but you're actually not getting results. So if you want to change your health and your life, there will be challenges and struggles. So you need to get good at the plan to overcome them, and not just plan how you overcome them. You actually have to have step every day. You have to take certain actions that are gonna give you the result that you want.
Yes, to help you heal from illness. And that's why we have people who actually comment on a post who tell us, I'm ready for this, but even though it's been a year, they've been following us for a year, and they still don't do anything about it. They're still sick with the same illness, or even worse, because they went to do something else. Again, people think they have to do some kind of detox to heal their body. They go on the juice fast, they're not eating anything, they're taking supplements, and they get sicker even more, and they become deficient. So if you're doing something and you actually become deficient, it's not a good plan for your recovery. And you don't need to fast to heal your disease. You don't need to drink juice, and you don't need to not eat anything or take supplements to heal a disease. And that's why a lot of people, they feel like they're planning, and another mistakes that we see people make is they take pieces of information from different things. And that's why you no longer have the plan anymore. You have different information And some things could be helping you, some things could be making you sicker, and you don't really know what is actually helping you, what is not, because you have too much going on. And
that's what one of our clients we worked with, she was following so many people on social media, like different doctors, they tell you different stuff. So the reason why she decided to work with us, because we actually gonna help her what's gonna work for her. Like every day we helped her because she was so overwhelmed. She didn't know if she should eat something. Other doctor will tell you should eat that, the other person will tell you not eat that. So she was really confused and overwhelmed, and she had a lot of anxiety because of that.
Yes, so she was looking for step-by-step instructions, what she has to do, have us watch her every day to make sure she's getting better and help her address any issues that arise along the way. That's why it's people don't get better, because they take pieces of information from different things and then they don't know what's working anymore or what's not working. And that's why it is very important to not just plan to get better, but actually take actions on what you have available to you and help you isolate what's working and what's not working, so you can course correct and move in the right direction. Okay?
Yeah, so when you have a specific plan, the struggles go away because you have a specific plan of action, not just how you plan to.
And you don't have to think about anymore because another person is doing all the thinking for you. And so what else do you want to talk about in this video? Let us know if you have any specific questions for us. Yes, so Melanie, if you want to reserve your spot for next opening, you can send us a message, and then I'll let you know how you can do that. Or you can send us an email as well. So in addition, a lot of people, they put all of the energy around what goes wrong and make the evidence that they can't have what they want or they cannot ever recover. So if you focus on everything that didn't work for you in the past, or why the certain way that you're feeling right now, it will prevent you from taking action because you focus on failures, right? If you focus on what's not working, you focus on failures, then it will prevent you from moving forward. Some people have this pattern where they believe they don't deserve something. There are different layers. That's why there's different layers of self-sabotage. There's layers of trauma, self-worth, negative messages through childhood, and negative messages regarding their disease and people around them, right? If your doctor tells you something, you can't get better, subconsciously you're going to believe that, and you're going to subconsciously sabotage yourself without even realizing it. So the reason why we started working with people one-on-one personally, it is because we realize that people need help every day when we coach them. This is the reason why we don't do consultations or appointments, because they're not as effective as having us watch you every single day to help you what's normal to feel, what's not normal to feel, and guide you through the recovery, knowing that you have to push through, and then things are going to be better on the other side. And in addition, there's so much more information online. Just our clients, sometimes they read things online and they get scared and they ask us, is this correct? Is this wrong? It's not correct, because everything we teach is based on the results, right? So that's why it's important to have the guidance, that person that you trust, who has the results, because we've helped people heal inflammatory diseases with nutrition, and you've seen them here on our page. How they've gotten better is because these people were able to overcome their fears, they were able to overcome their self-doubts, and also they reached out to us for help and questions and support. And that's what it takes to be successful in disease reversal, is letting us trust us to do all the thinking for you. And that's why our bodies are constantly in the state of trying to repair. But if you, like a smoker, you re-injure yourself with food and with smoking, right? So that's why people who quit smoking, they can get their lungs levels up as long as there is no scar tissue, and their lungs are able to improve over time, as long as they don't damage their lungs with smoking every day. So in order to heal your body, we have to stop re-injuring. And that's why people, why they still stay sick, is because they keep re-injuring themselves. People eat things that help them, and they also eat things that hurt them. And that's why they don't heal from the disease. So for example, a lot of people, there's so much information about MCT oil, coconut oil. It's actually, a lot of our clients have been drinking that, but it's saturated fat, it damages your blood vessels. But not just there's no studies why people should be drinking it. There's no benefits except it raises your cholesterol.
So that's why you might read coconut, it's healthy for healthy people, but it actually can make your disease worse. So that's why there's healthy foods that's not going to help you heal.
There's healthy foods that make people sicker, and the reason a lot of immune doctors will tell their patient to eat inflammatory foods, but they don't understand why it's inflammatory in a cellular level. And we explain our clients why you should not eat this, but you should eat this instead, okay? And that's why it's really important that some people even they think they're helping you, but they're actually making your disease sicker, okay? And so now that's why, let me know if you have questions about what we talked about here. Is it's important to stop re-injuring yourself, and that's why half of the things people can be eating are helping them, and half of the things they're eating is making them sicker. And you want to stop doing everything that makes you sicker, but also give your body the right nutrients in the right amounts to be able to accelerate the repair process. And we had somebody with lung fibrosis work with us recently, and his lungs started healing. And that was never seen by his doctors before. So his lung function actually went up in a program within 7 days, even though he already had fibrosis. He already had scars in his lungs.
Yeah, and actually I posted his video on my personal profile, and somebody just told us, oh, this is really funny because you can't reverse lung fibrosis. And the reason is people say things like that because they never done it. Doesn't mean it's not possible. So her statement, she just commented, it's not correct, because just because she never done it doesn't mean it's not possible
To get better.
And so that's why,
and be able to get off oxygen machines. So that's why the same thing with kidney issues is we like working with people who have kidney issues because we can see directly how the labs are improving. So we've had a number of clients who were able to get off their dialysis, even people who had 5% GFR. And of course, if you having, because what can cause kidney failure is high blood pressure, diabetes, even high cholesterol can lead to heart attacks and strokes. How many of you know somebody in your family who has died from heart attacks and strokes? That's why nutrition is very important to be able to help you clear up your arteries and remove the resistance that's in your arteries to allow your blood pressure to flow normally. And that's why hypertension heals really rapidly when we work with our clients. We've had clients who took medications for high blood pressure, even those medications were not working for them. We have a video with one of our clients on this page who tried all kinds of medication for her blood pressure, and her doctor said that she is at risk of getting a heart attack, and also her kidneys were failing. We got off all of that within 6 weeks. So with nutrition. So that's why all of these conditions like diabetes, high blood pressure, they can lead to things that are a lot more serious, like kidney failure. And that's why you don't want to wait until you are at the stage where your kidneys are functioning at 5%, because you're never going to be able to get them up to 100% at that point. And then there's other issues, wound infections, they can lead later on in life. And that's why the same thing with gut issues. People have chronic gut issues or colitis or Crohn's. Eventually it can lead to things like cancer. We had people who had gastritis that their long-term gastritis led to metaplasia, and now their doctor is telling them, well, we can help you. Of course the doctor hasn't been able to help them for the last 20 years with gastritis, just gave them a bunch of medications and proton pumps that make things worse, okay? And now they're dealing with metaplasia, precancerous condition, and the doctor just says, we're just gonna watch you until you get cancer. What kind of solution is that, right?
Yeah, we actually, this week we at the coaching event.
We had the coaching event, and there is a doctors there who are changing the health industry. They're changing in how the hospitals are operating. This is the hospitals of the future. Of course, these changes can take anywhere from 50 to 100 years to take an effect, where doctors are not just prescribing medicine, but they're also prescribing nutrition and other lifestyle factors to help you not just prevent your disease from developing, but also reverse it. And that's why this is the future. But as you know, the medical industry, the medications, it's $1 billion industry, and they will do everything they can in their power to stop people like us from helping people, okay? So that's why it's you want to be able to learn so you can educate your family, your kids, your grandchildren. A lot of our clients want to be there for their grandchildren, for their families. They want to see their kids grow up and not spend the last 20 years of their life in the hospital. And I also, when I was early in my 20s, I have volunteered. I have over 300 hours of volunteer services when I was in college. I've seen people in the hospital who were only in their 50s, in 60s, and they basically live in the hospital. First they get pneumonia, then they get cancer, they get something else going on. And it doesn't have to be that way. You don't have to spend the last 20 years of your life in and out of hospital and on medications dealing with one illness to another one. Is you can take things into your own hand and recover. And we had one of our oldest clients was 70 years old with rheumatoid arthritis and type 2 diabetes, and he was able to reduce his steroid medications and get off his insulin. So that's why it's never too late for you to recover, but the sooner you do it, the longer, healthier life you're going to have, and learn what you have to do to be healthy. And that's why people ask us, can we help them with autoimmune diseases? Yes, we can, but also cardiovascular diseases, which is a common issue out there for everyone, okay? So again, if you're looking for personal help, send us a message and we'll let you know when the next opening is and how you can schedule a call with us to talk more about your problem, your health problem, and we can learn more about your situation and see what we can do for you, okay? So that's what you can do. You can reach out to us, send us a message, and we'll go from there. Let's see what else. If you have any other questions for us. Hi, Demaris. Good to see you. Hi, Michelle. I hope you're doing well. And actually, we just posted one of our past clients from 2019. She's still doing amazing since we worked with her. She's followed everything we've been everything she's learned in our program, and she had Hashimoto's, asthma, fibromyalgia, and she's doing amazing. So still doing symptom free from 2 years ago. Mm-hmm. And we also shared one of our other clients with colitis, also from I think it was 2019 December. We worked with him. He had colitis, and he's off all of his medications and no symptoms since then. So that's why it's important to follow everything we teach to be able to see more health improvements in your recovery, in your inflammation markers. And also another one of our clients with Hashimoto's, 6 months later, she reported to us that her ANA is finally negative. It was positive for all these years. And so 6 months later, she reported that her ANA turned negative. And also her Hashimoto's antibodies dropped down to 12 also as well. And they were over 300 when we started. So over a year ago. So that's why it's important to keep going. And creating healthy immune cells in the body, okay? Yeah, and also in our program we teach how to heal your body and also how to maintain your results. So that's really important because everybody can just do something for 2 weeks, but then they don't know how to sustain their results long term for the rest of their life. So that's why there's difference between what you have to eat for health, just to be healthy, maintain your health, and there's a difference what you have to eat for disease reversal versus maintain your health. So, and that's why Annabelle asked, are these clients still eating the same things? Did they reintroduce new foods in their diet? So that's why based on the progress each person makes, we tell them what they have to do to either keep going until they achieve the results that they want or to maintain their health. And many of our clients who have healed from their disease, who told us that they haven't had any symptoms, their labs look normal, they're able to reintroduce new foods and other things into their diet and not get the disease back. So that's why there's so many things you could eat when you're healthy, but when you're trying to heal from the disease, you have to do what is required for you to be able to repair the inflammation and also your organs and your cells and your immune function. And that's why this takes minimum 4 to 6 weeks to be able to set you up for successful reversal of autoimmunity, and then the healing continues beyond that. So that's why based on the progress each person makes, we tell them individually what they have to do to either continue their healing or to maintain their health, or maybe what other things they can introduce back into their diet while they continue their recovery. Makes sense? So whatever is going to work best for each person to be able to continue on for 3 to 6 months and start and seeing more and more results, okay? So that's why it really depends on individual case. And also if people are able to do their nutritional plan to the full capacity. Some people they're not able to do it to full capacity. For example, people who have gastritis or they have colitis or Crohn's, they're not able to eat the right amount of the food we tell them to eat. They're only eating half of the things, and that's why we work their way up to what they can eat. And because if people have acid reflux, they can't eat certain things, so we have to make adjustments based on what your body can tolerate and work your way up. And that's why, but the more you can start, that's why it's better when people don't have gut issues, because they can go right into the program and recover right away. So that's why people heal at rapid rate, which if they're able to do the program to full capacity, and as well as it depends what people have been doing or eating prior to working with us. So sometimes people who eat a lot of inflammatory foods, one of our clients who had arthritis, she was eating a lot of inflammatory foods, so she had the like wheezing type of symptoms, like mucus coming out of her nose for several weeks, because she was so toxic on a cellular level, because before she started the program she was eating a lot of inflammatory foods. So that's why people have to go through detox symptoms which happen naturally in order to be able to just go through that and then start their recovery.
Yeah, because there's a difference between your health getting worse and you're actually going through recovery. So sometimes people can't tell the difference. They don't know if they're actually healing or they're actually getting worse.
But that's why we watch our clients every day, and we know what's normal because we helped other people heal from chronic diseases. So that's why we know what's normal to experience, what's not normal to experience. But as long as we watch our clients, you have nothing to worry about, okay? So because we're watching you every day, what you're doing, what you're eating, what your symptoms are, and we're guiding you through the healing. So we know what's expected to feel in the first couple of days and what's not expected, okay? So that's why as long as you submit your report, you're asking questions, we are there to know and guide you through the recovery, okay? So that's why sometimes people they can't get through the detox, and that's why they never heal, because you stop the healing process and you want to continue doing what you need to do, okay? Okay, so let's see if anybody has any other questions. Otherwise, we're gonna finish up. We have a client class coming up in 30 minutes. We have to prepare for that class, okay? And again, for the recovery, there's a lot of people think that they have to do like not eat anything. You don't have to fast to heal your disease.
Or juicing or things like
we
juicing.
actually ask our clients to eat more food that they have to eat to heal, right? So fasting goes against that. When you fast, you're actually starving your body of nutrients that are needed for cellular healing and repair. That's why we don't recommend fasting in our program, because the more you eat of the food that you have to eat to heal, the faster you will repair.
So that's why the fasting and juicing is a temporary solution for people. The only reason why they might feel better in the moment, because you're not eating anything. But when you start eating again, your symptoms come back. So that's why people can do those. People sometimes do detoxes or they do juice fasting, but it's not a long-term plan. It's not a life plan that you actually get the long-term results. It's just a temporary solution that can help you feel better, but you can't sustain it.
Yeah, and Annabelle, we have a client class today, so you can join a client class and ask all your questions there, okay? And so all the program questions, anybody who's watching this, who is a client, there's maybe other clients who are watching this video, ask your questions related to the nutrition that you're doing in a class, okay? So this is a more general questions that we are answering. And Debbie said, wish I could get my son-in-law who suffers from MMG to contact you. He's so miserable. Yeah, you can share a Facebook page with him and our website. And he can follow us and see and get more information and learn more about it, okay? So another thing that I want to talk about, so that's why a lot of people do celery juice, but they actually don't get better, because celery juice, it's nothing more than mostly water. Water is not going to repair your cells if you're just drinking liquids. And that's why if you're just drinking water, it's not going to repair your cells, okay? And I'm getting a call from my dad, so we have to finish up this meeting, okay? And then we're gonna connect with you next time, okay? We do have a client class coming up, and we'll connect with the clients there. The same thing, Rhonda, we don't recommend intermediate fasting either. water fasting or intermediate fasting, because it doesn't allow you starving your body of the nutrients and it needs to your cells need to repair. Your cells need tools and nutrients to heal.
Yeah, so because we have trillions of cells in our body, and your cells need the food to heal. And when you're not feeding your cells cannot repair itself. Your body cannot make new cells, because your body makes new cells out of the food.
And that's why people who some of our clients that we worked with, one of our recent clients, she was fasting all the time, and she was so starved of nutrients. She was eating 10 times the amount of food than other clients in the program, because she basically, before program, she was not eating anything. And that's why we actually ask our clients to eat more and more foods to be able to heal as rapidly as they can. And fasting, when you're not eating, you're not giving your body the tools and nutrients to repair itself. And as soon as people eat something inflammatory, the symptoms come back, okay? So that's why we don't do that, and it doesn't work.
So you still need to eat to heal. That's really important, because you can't fast all the time. You can fast for the rest of your life.
Yes, you can continue fasting for the rest of your life.
And then every time you eat, you get symptoms back. And then when you don't eat, you don't have any symptoms. You feel better. So that's like a temporary solution. That's why if you're doing juice fasting, you might feel better, but it's only when you start eating, you don't feel good. So it's not a good plan to have when you have to do that for the rest of your life. Just keep fasting.
You want to work on the lifestyle, change your lifestyle, learn what you have to do to recover, and then learn how to maintain your health. Okay, so we're going to finish up this class, because I also do have to prepare presentation slides, go over my presentation slides for our clients. And those of you who are interested to work with us, you can send us a message and we'll let you know when the next opening is, okay? It was great seeing everyone. Thanks for connecting. And we're going to talk to you soon. If anybody has any additional questions, feel free to ask them again. Thanks for tuning in. Hi, Charles. Hi, Sergio. Hi. I think I said hi to everybody already. Joseph, good to see you here. Melanie, Crystal. Okay. We're going to finish up, and we'll talk to you soon. Okay, bye.